Aplastic anemia is a form of pancytopenia wherein there is a decrease or deficiency of all blood cell lines, which includes the red blood cells, the white blood cells, and platelets. So the term aplastic anemia, which just refers to low red blood cell count, is actually wrong and inaccurate. With aplastic anemia, there is anemia that causes poor tissue oxygenation, leukocytopenia or low WBCs, which cause increased susceptibility to infections, and thrombocytopenia or low platelet count, which causes increased bleeding, even from minor injuries and mucosal areas. So aplastic anemia is rare, however it is considered to be a very serious condition that can be developed at any age and can occur suddenly, or it can come slowly that may worsen over time. So this comes in many forms ranging from mild to severe depending on the cause. Now, red blood cells are produced in the bones of the body, mainly in the bones of the pelvis, the ribs, and the sternum through a process called hematopoiesis. But for aplastic anemia, the process of hematopoiesis does not happen and it stops making new blood cells, which leads to this disease. There are many causes of aplastic anemia, but the disease is most often idiopathic or without an unidentifiable cause. Acquired causes may include exposure to radiation and toxins, taking certain drugs such as chemotherapeutic agents, anti-seizure agents, anti-inflammatory medications, anti-thyroid medications, and antibiotics. History of certain infectious diseases such as hepatitis, HIV, Epstein-Barr virus, CMV or paravirus B19, history of autoimmune diseases such as lupus, and clonal or genetic disorders. Most common genetic disorder associated with aplastic anemia is Fanconi's anemia. Symptoms of aplastic anemia include fatigue and pallor due to low RBC, mucosal bleeding due to low platelet counts, and recurrent infections due to low WBC. Other symptoms may include headache, dizziness, upset stomach or nausea, shortness of breath, blood in stool, fever, sore sinuses, enlarged spleen or liver, white patches in the mouth, or oral thrush. Aplastic anemia may be suspected with CBC or complete blood cell count, which shows low RBCs, leukocytopenia, and thrombocytopenia. Erythropoietin or EPO are also increased. So EPO is a hormone released by the kidney that tells hematopoietic stem cells to grow and divide into new RBCs. So with aplastic anemia, there are not enough hematopoietic stem cells to create appropriate amount of RBCs, so more and more EPO gets produced in an attempt to compensate. There is also decreased reticulocyte or young RBCs, which means there is decreased production of RBCs. But for a definitive diagnosis, it will require a bone marrow biopsy, which will show low hematopoietic stem cells with normal cellular morphology and absence of infiltrative disorders. Treatment for aplastic anemia will differ based on various factors such as your age, overall health and medical history, how sick you are, how well you can handle certain medicines and procedures or therapies, how long the condition is expected to last, your opinion and or preference. For people under the age of 50, a stem cell transplant is the best option. But for those who are greater than the age of 50, the therapy needed is immunosuppressive therapy with medications such as cyclosporine and glucocorticoids. Blood transfusions may also be necessary for severe cases to treat low blood cell counts. In certain people, a bone marrow transplant may cure anemia. So living with aplastic anemia means you have to work closely with your healthcare provider and following your treatment plan. Important things to do if you have aplastic anemia is to stay away from people who are sick, avoid large crowds, wash your hands often, avoid foods that are not cooked all the way through, brush your teeth regularly, get your annual flu shot, and develop a physical fitness plan with your provider. As a recap, aplastic anemia occurs when your bone marrow does not make enough red and white blood cells and platelets. This condition can make you feel tired, raise your risk of infections, and make you bruise or bleed more easily. To treat the low blood counts, early treatment involves easing symptoms. So treatments may include blood transfusions, antibiotics, medicines to stimulate bone marrow production, and other therapies. And in some cases, a bone marrow transplant may cure aplastic anemia. So that ends my discussion about aplastic anemia, and this is Ruffa from section M3A, and that is all. Thank you.